Hi, my name is Cam, and this is my voice 15 minutes on T. Hi, my name is Cam, and this is my voice 1 month on T.
Hi, my name is Cam, and this is my voice 5 months on T.
Hi, my name is Cam, and this is my voice 7 months on T.
Hi, my name is Cam, and I'm 1 year on T.
This is a warning for parents who may be caught in the crossfire of this modern malady.
When Kira was a teenager, she desperately wanted to be a boy. Now 23, she regrets the transition she underwent and says instead she was struggling with a complex identity issue.
I was lost and confused, and I thought that was the solution to my problems, and they led me to believe the same thing. It just happened and it snowballed.
And today, 3 judges at the High Court agreed that children under the age of 16 were unlikely to be mature enough to consent to taking hormone-blocking drugs, delaying puberty.
I'm over the moon with the decision because, it's more than we, could have hoped for. And, it means protections are reinstated for children and young people. I'm, of course, very angry because, those protections weren't put in place, and the professionals, in my opinion, weren't doing their job. And, it's caused a lot of harm to a lot of kids.
Gender dysphoria is a psychological condition where an individual's internal state of gender isn't accepted and isn't contingent with their biological sex. So a biological male, may think they're female, and vice versa. Whilst this is considered a medical and psychiatric condition, there are no known tests for this. We can't go and take a blood test. We can't do brain imaging. There is not even any genetic screening for this condition. It is simply based on feelings. And any psychologist will tell you that feelings are a dangerous area to base diagnoses on. How I feel one day is very different from how I feel the next day, much less in a period of neurological and social development. But what's happening today is many children who may yet not be fully aware of who they are still learning about their own identity, are being pushed into medical treatments which may have long-term and permanent consequences. I'm Jo Bailey, I'm a clinical psychologist, and I'm going to talk about this growing trend, and I do call it a trend, a concerning trend of medicalising gender dysphoria. And I want to make it clear, I'm specifically talking about this condition in the context of children and young adults, adolescents.
You have put all your faith and reliance onto these medical practitioners, then you're going to end up believing exactly what they're saying. And over the course of the years, I most certainly believed in what they were telling us, that I was an ideal candidate for gender reassignment surgery. And I submitted to that idea. And that is a regret in itself. I regret trusting them. I really do.
These children are often told that they're possibly in the wrong body for their gender. And in response, they're led down a path of what is called gender affirming therapy. And what does this path look like? Well, it starts with a social transition where kids are encouraged to adopt clothing, pronouns and behaviours that are associated with the sex that they think they identify with. But then this is followed with more powerful medical intervention with things like puberty blockers and cross-sex hormones. But here is the crucial point. We are experimenting on these children. Many of these kids are too young neurodevelopmentally. The brain is still growing until children, young adults, are in their 20s. 15, 16 or 17-year-olds cannot be neurodevelopmentally ready to make these life-altering decisions. And so they're pushed through this political agenda and from the woke left that continue to reaffirm them. They're being pushed into making life-altering decisions by an ideology that has become more about promoting a political agenda than it is about genuinely helping vulnerable children. And I want you to know that I am coming from the position of compassion and caring for these kids. I have no agenda other than to really value these children, to help them through these periods of exploration and curiosity, and to ensure that their well-being is protected. In my opinion, it is a dangerous social experiment with no clear long-term evidence to support its efficacy. I see a lot of young people in my practice that come to me all questioning their gender identity and wanting to be known by new names, demanding that the people around them, their parents, their friends, our clinic, call them by their new name and identify them from their chosen gender. We actually have a program that allows us to change their gender identity so that we don't make the mistake of calling them by their dead name, their old name. I've seen people at age 15 receiving puberty blockers. And let's talk about puberty blockers for a moment, shall we? These are medications that prevent the body from entering into puberty. These drugs essentially halt the body's natural process of sexual development. And the idea is that they buy time for the young person to make a more informed decision later on. But that's not what I see happening. And here is also another problem with that. We have no long-term data on the effects of these drugs that we're giving these young developing bodies. We don't know how they will impact a child's brain development, their bone density, or their fertility. We just don't know. What we do know is that halting the puberty process will disrupt the natural progression toward adulthood, and this can cause irreparable harm. We're really wandering into uncharted territory, a very dangerous uncharted territory. These medications will act on the pituitary gland, which regulates crucial hormones like testosterone and estrogen, amongst others. And by stopping this natural process, the child's body is denied normal development and sexual characteristics. And once the puberty process is blocked, the next step is often cross-sex hormones. These are testosterone for girls or estrogen for boys. And these cross-sex hormones then lead to even more permanent changes. Platforms like YouTube, Tumblr, and TikTok play a significant role in shaping young minds. And these platforms are often pushing the idea that transitioning is the only solution to gender confusion. This has created a social pressure for children to identify as non-binary or transgender or one of the many other terms that seem to pop up every other day. But instead of offering these children the tools to explore their own sexual identity in a very healthy and open-minded way, we're rushing to medicalise the process, a perfectly normal process, a perfectly normal phase of development and exploration. And here is the sad part and the reason I'm making this video. The parents are falling victims to this propaganda. They're being told that transitioning is the only solution, and they're led to believe that if they don't support it, that they're somehow harming their child. In fact, critical thinking and informed consent are absolutely necessary to navigate this dangerous territory. I have had so many parents that I've had these conversations with, well-intended, loving parents who are being told by the schools, by the counsellors, by other medical professionals that they need to support their child. And support means facilitating this curiosity and facilitating access to gender clinics. I had a parent once who was in tears as she told me about buying her biological daughter clothes. Now, she had to call her daughter by the new name, and she had to buy pants and slacks. The daughter got her beautiful hair cut off very short, and this parent actually helped her daughter access these puberty blockers and then the sex hormones, the cross-sex hormones. And sadly, a 16-year-old, she was just turned 16, was taken to a hospital to have a mastectomy. 16 years of age. Now, this parent thought she was doing the right thing and was being supportive, but she did it reluctantly. She did it through tears and through a desire and intention to help her child. But something told this parent it wasn't right. If only she had have listened to that intuition. See, as a psychologist, I see firsthand the devastating impact of this ideology. This is not about helping children find their identity. It's about pushing them into an irreversible medical procedure based on an idea that has been heavily politicised and pushed through social media. And let me be clear, Gender dysphoria treatments are not as benign as some would have you believe. These are powerful medical interventions that come with all the risks, side effects, and permanent consequences of any other major procedure. But in this case, some of these procedures are irreversible. You can't just wake up the next day and think, well, I got that wrong. And it's not just the physical risks. Puberty blockers, cross-sex hormones, and these surgeries come with life-altering consequences. And there are psychological risks as well. I mean, what happens when a child transitions and regrets it later in life? The emotional and the mental toll of a permanent change to one's body cannot be understated. And there are so many people that actually go through this and regret it and then try to transition back. Their pain is real. I'm not making this up. I have dealt with these, and you can see these on the internet as well. There is another side, a very dark side to this process. But once that medical path has been taken, there is no turning back. Ultimately, we must ask ourselves, why are we pushing children into this, into these medical interventions that may or may not be necessary? But why are we pushing teenagers and young people to make a decision, an irreversible, permanent, life-changing decision? Why? As a society, we need to look at the evidence, the real evidence, not the politically motivated narratives. And we need to ask if these treatments truly are in the best interests of the children. Let's stop treating gender dysphoria like some kind of trend or a political statement and start treating it like a serious mental health issue that requires careful consideration and a balanced and an evidence-based approach, a compassionate approach. The push to medically transition children, young adults, into these decisions is nothing short of reckless, and we need to demand more accountability from our medical professionals. Before pushing forward with these extreme treatments, we must ask, are we really helping the kids, or are we just feeding them into an ideological machine that has no regard, really, for their long-term well-being? If you have a child and you're confused at the moment about these decisions, I urge you, please block out the words of these woke counsellors and clinicians. Go with your instinct. Listen to what that intuitive maternal or paternal voice is telling you inside. Or at least pause. Don't rush into this. There is time. Despite what you're being told, you don't need to rush into this decision. This is not the only opportunity to go down that road. Should your young person still want to pursue it later, let their brain finish developing. Let them get through this period of exploration and natural curiosity and come back to the decision later. It does not have to be made right now. And if that's all you do, press pause and wait a while. It may be the most responsible and loving thing you'll ever do as a parent.
I'm angry. What's going to happen to the kids and the youth? I'm sad for humanity and the children and what's going to happen.
I 100% feel like I was part of some cruel medical and social experiment.
I've now been living as a woman for 28 years and I fully regret this.
I can't believe this happened. I ruined my life.